Okay, Assalamualaikum everyone. I will show you some issues or some tasks that we need to do for OM clinic. So first of all, we need to approve the progress note and also to do the logbook. So after you've done the clinic, you can go to patient's record. So for example, I'm just going to do this and open the patient record. So first of all, I will go to the progress note. Okay, and look at the progress note that the student have done. Usually I will ask them to do on a separate document first so that I can check and correct it. After I check and correct it, they will transfer to this. All right, so the status usually here is A. So what we need to do is do the approval first because they only transfer after you approve or you have checked the progress note, so nothing much that you can do here. But if you have any additional notes that you want to add, you just write the notes here and then you can just click add button here, the plus button here. All right, then what you can do is go to verify with QR code. Okay, so this QR code will appear, so you can download your iDeRMS Plus and then try to scan with the iDeRMS Plus app. Okay, so now I'm just scanning the iDeRMS app, the iDeRMS QR code. Okay, this QR code. Then I approve it. I approve it on the phone. Okay, close. Then if you refresh this, you will see the progress note has been approved when your name appears here. So I approve it, so my name appear here and MR, but the status is still A. So you need to do is what you need to do is go to here and complete the procedure. If the procedure is already completed, usually for the review appointment consultation is completed, so just complete the procedures. Okay, all right, so that's what you can do for the progress note after the clinic is done. All right, now we're gonna go for the e-logbook. Go to undergraduate and find the undergraduate that you want to approve. So for example, I'm just going to select the student that done this progress note. So please make sure the code is DDM503. Some student put DOM503, that is the old code. The new code is DDM503. Okay, and then click action button, view progress, click the view progress. And something like this will appear, and then you can put a mark here. Okay, it doesn't matter what you think is the rubrics is here. You can click the rubrics, you can see the marks. Excuse me. All right, let's say I'm just gonna give marks for the student. If you have comment, please do comment anything here in the comment. Can improve, for example, I can say can improve with the clocking. Okay, and save. And when you click save here, you don't have to click save for everything. You have to click save at the end of it here, and it will save for the whole thing. Okay, and do not forget, after you save this, you need to close the assessment. Click close, and this is the total mark, the average mark that the student obtained for this assessment, and then click close assessment. Okay, normally we have two students doing on the same patient, so you can click the patient RN number here again and find the other student that does this. Okay, go to undergraduate and find another student from here. All right, so that is the logbook. Another thing is about attendance. So for attendance, as I mentioned in the email, when you click the attendance here, student attendance, this is pertinent for any preclinical or clinical sessions. So for preclinical is CSL. It can be pathology as well, preclinical, and then it can be radiology. Okay, for clinical is OM clinic. Okay, so just make sure select the location. The program code is DDM 503, and then you can select the discipline for OM clinic is OM clinic. Okay, so year and group. So once you click the submit button, what happen is you need to go to the list here. Let me go back to the list. Okay, once you done that, it will appear something like this. So click the purple button, okay, and then you need to click the status. Okay, so this is already done, so you don't see the unfinished one. And if the student is absent without informing you, then we consider is absent without a reason. If they absent with MC, they inform you they went for medical checkup or they are sick, then just put the remark is student is sick. Okay, and click the absent with reason. All right, then you click save, and then as a here department, there is a verify button here, so the here department will verify here. Okay, so that's it for the attendance. All right, and then another thing is for any prosthetics, you have to put another code for prosthetic, which is soft or hard splint. It is available in the item. So usually I will use student account. Student need to put that code so that patient do not have to pay a lot of money. Okay, patient has to pay here, and also patient to have to pay for the lab charge as well. So maybe for any prosthetics, any mouse guard, splints, put another code. I will show you perhaps an example of the code. Let the student do this anyway. Okay, you put add new treatment, go to prosthodontic, and then you can type splint. So there you go, there's a customized occlusal splint. For us, our charge is 80 ringgit. Occlusal splint, hard, simple, 80 ringgit. This is not a lab charge, this is only the clinical charge. So if we use our account, these are the charges. If the student use their account, I think this is will be a lot less or even free, but patients still have to pay the lab fee. Okay, so the lab fee is around 80 ringgit as well. So please do put this treatment along with the consultation code as well for every treatment. Okay, for every treatment of splint. All right, other than that, please make sure your patient has consent. Try to get the consent done every time the patient comes for OM. So this one is no OM, no consent. So consent only has to be taken once as a patient in dentistry. Okay, so just click the sign consent and get the patient to sign the consent. All right, because many of us now forgot to do the general consent. Usually it's done by the Sapphire, but sometimes they forget. Just try to do this here. Okay, I think that's all for now. Thank you.